Athar Mirza, Vice President, Global Infusion Systems for Baxter International. Thank you for joining me on the Future of MedTech series, and we're going to discuss the future of connected health.
Yeah, thank you for having me.
So I know I've gotten the privilege of getting to know you and better understanding how Baxter International works with connected health. But what I don't really know is, why are you interested in connected health? So how did your journey lead you here?
Yeah, it's a really good question. I started off working at a company in the lab. It's called LabCorp. And we were focused on laboratory information systems. So this was very early on when we were able to send lab results to our customers and to their patients. So customers can quickly look at lab results and make decisions. From there, I actually worked at a healthcare system and I implemented an Epic EMR. And from there, I got a significant amount of experience at looking at how healthcare is delivered and the influence technology has on improving the patient's outcome. And then from there, moved to Baxter and have been working on infusion pumps for the last 14 years. I've been at Baxter 14 years and really focused on how the device connects to the EMRs. As you think about an infusion pump, actually, as you think about devices at the bedside, the infusion pump is likely the most critical device. That's the device that's changing the patient's condition. A lot of other devices are monitoring them. And so making sure that's connected can significantly improve patient care and the way that delivery is handled. And so that's been a passion of mine I've been in healthcare for 25 years. I've been working on connected care for 25 years. Baxter has, and we talked about this earlier, about 1.5 million devices connected globally. Tons of information, tons of data on those devices, and making sure we can get those to our caregivers is one, it's fun. Two, it's exciting. And I think we can pave a road ahead of us.
Oh, I love that so much. So I didn't realize that you were in MedTech for 25 years.
Yeah.
I'm coming on my 19th year in MedTech. And I think historically, traditionally, when you think of MedTech, you think of kind of implantable devices, something you can hold. And I remember when and speaking of converted here, but when digital health came in, and that was the big buzzword. And I think that has really evolved to what it actually is, which is connected health. Did you always see that you can't have just one device without having a connection? Like, did you feel like it always needed to be this full circle for the best outcomes?
Yeah. So when you think about the acute care space, there are anywhere up to 15 devices that are connected to a patient. And it's not just one caregiver, it's a broad caregiving team. And so the information all those devices have influence the outcome of the patient. And so aggregating all that data, aggregating all that information and presenting it to the caregiving team in a meaningful way, allowing them to make decisions, I think to answer your question is going to drive a lot of what we're going to see here in healthcare. The second piece of that is how do we personalize that? How do we automate that? So creating devices to talk to each other. So they're balancing each other out. If a patient's glucose level goes up, how does that affect the way the infusion pump reacts? I think you're going to see a lot more of that in healthcare. So it is moving away from an implantable device to all the devices that are at the bedside to treat that patient.
Well, extremely well said. And from my history in MedTech, it's actually one of the most exciting times, I think, in MedTech, because you can really see the change that connected health has provided from the clinician to industry to the patient, of course. It's really been so impactful. I see it as such a positive thing, but there has to be challenges.
Yeah.
So what, from your perspective, are the current challenges when it comes to connected health today?
Yeah, I think it's change management. Actually, there's two that I would say. One is ensuring that manufacturers are working with each other to create that meaningful story on the patient. And so it can't just be done by Baxter alone. We want to work with other manufacturers to bring that comprehensive story for that patient. So I think that's a bit of a challenge that we continue to work through. The second one is just compliance or change management. So, what's working today is working really well as we look towards the future and try to progress healthcare. it makes people uncomfortable. It makes organizations uncomfortable. It's our job to, one, give them comfort and make it cost effective as well. I think what you see driving a lot of the implementation and adoption of technology is improving patient outcomes, limiting nursing turnover, and automating healthcare as much as we can. So I think you're going to see, I think those risks are there, and I think over time you'll see people get more comfortable with it and adopt it.
So do you see this as the three examples that you gave me? I mean, that's in a way how the industry is responding to the challenges already. Do you see any other ways that industry is responding to these main challenges, to bring that comfort, that security?
Yeah, I think just it's up to the manufacturer to make sure they have a easy to use device, a device that's easy to implement, and that's connected to their system, not just to our portion of our devices. I think those are critical. I think about, we talk about diabetes, and it went from a finger stick to now there's a continuous glucose monitor. There's still people out there that won't wear a continuous glucose monitor because they just don't know how to use it. They're uncomfortable with the technology. So it's up to the manufacturer to make sure our healthcare organizations understand what we have and it's easy to implement. And I think that will then drive adoption and further use.
That makes a lot of sense, especially the way we think about sort of innovation moving forward iteratively. And I loved the example you just used. Are there any other ways that maybe the industry is responding using this example specifically that might help move that needle or might help innovate in the short term? So bring that patient who maybe doesn't know how to use it, now feels comfortable using it, now has the education to use it. Is there another in-between step that we could do to bring that innovation where it needs to be today?
Yeah, part of our design process, I will answer your question in making sure it's easy to use. And so the way we make it easy to use is we do extensive human factors testing. We do extensive voice of customer to make sure that product, as it's implemented, it's adopted. A lot of times what we see is minimizing the workarounds. So if we're rolling out a device, clinicians will find a workaround. They're comfortable with what they use. They're comfortable with how it works, but providing them value on top of their current workflow, I think, can help increase and drive more adoption. So I think that, to me, would be the in-between before we get to the Holy Grail.
That's very encouraging. So we are talking about, the future of connected health. You and I both know, and everybody in this room knows, that technology is accelerating at such a rapid rate that when we say future, I could be talking about next week.
Yeah.
It's pretty unbelievable in that way. So maybe we talk about the future of connected health, just as I mentioned, kind of iteratively. So a year from now, what do you hope to see? What do you think we will see when it comes to connected health this time next year?
I think you will see more AI use in healthcare, and we see it today. It's predominantly non-clinical, so scheduling, billing, where I think we would be in 1 to 3 years, and we are leading the way in this. Baxter is leading the way in this, is being able to use AI to make clinical decisions. Have our healthcare providers have a support system using a national database and algorithm that allows them to make better decisions for the patient, but still giving them the autonomy to make that decision. I think you should see that in the next 1 to 3 years.
What about, so it was 1 year, 2, 3 years. What about decades?
I think if I were to talk about what Baxter's vision is and where I would be happy in the next, let's say, 5 to 10 years, is clinicians spending more time with the patient than doing ancillary work, and using technology and innovation to automate those other items that they were working on and get them back to the bedside. So I'd say in the next 5 years, we'd like to see that. And that's measurable today. I think right now a clinician spends, I think it's about 30% of their time with the patient. We can change that. We can have a direct impact on that. And that's really what our vision is. And so all the things that we built, the AI, the integration, the automation, it's really driving towards that.
Many people have heard me say many times that, from my perspective, artificial intelligence is allowing humans to be more human.
Mm-hmm.
So
I like that.
really have the same, I'm getting the same essence from you, that if we can maybe flip that statistic, so clinicians are with patients 70% of the time.
That's exactly it.
Can we just imagine how different the clinician and patient relationship might be? How different the way we approach care. I mean, the opportunities around that are absolutely limitless, and it's really exciting.
It is.
Maybe sort of last question, still thinking about the future, and you can frame it through the lens of Baxter, or frame it through your own personal hope. But for you, if you had a dream bigger than we can even imagine, what could connected health be? Or, we talked about digital health to connected health. Like, what could that next step be in 20 years, 50 years? Like, what could that be? Is there even something?
Yeah, I mean, I think what you're seeing now is more care at home. And I think there's a level of comfort. There's studies out there that people recover faster. And so if I were to think about, next 10, 20, 30 years, obviously making sure there's not as many sick people. People are living longer. They're living healthier lives. But getting in front of that before they get sick. And so, I think about healthcare at the home and getting patients treated there, because there is information. There are connected devices. Everyone has a Wi-Fi at their house, and that's doable. And so being able for patients to get taken care of at home versus having to go into an acute care facility, I think we'll see that down the road. We are seeing care move in that direction. But one, being proactive, and I think more care there. It's called hospital at home. I think we're going to start seeing that more and more.
Being able to treat more patients, bring care to the patient, that's really exciting.
It's huge. It's huge.
Well, I have loved every second with you, as I always do. So thank you for sharing your insights.
Thank you.
And I'm going to connect with you a year from now, and we'll see what's coming true.
Okay, hold me accountable. That's good.
So thanks again for joining us on The Future Of.
Yep, I appreciate it.